Well, hello everyone. Welcome to another iWoman Report. I'm Kathleen Trigg-Jones, and today I have a very special co-host joining me, my husband. You all know him as Dr. Michael Jones, world-renowned plastic surgeon, father, husband, all those kinds of things, jazz musician extraordinaire. But we're really happy to have you joining us today on the iWoman Report.
Well, I am so excited to be here. Thank you for having me.
Thank you. This is your second time joining us, so thank you. And I have a little secret to tell because we've been quarantined together at home for, I think almost 9 weeks now, has it been? At least 8 weeks. It's been a long time. I'll just say this is the longest time in the 20 years that we've been married that I think we've spent every single day together. Would you say?
I would, yeah.
Yeah, so you don't realize how little time you really spend together until you're forced to spend time together, and it has been amazing, hasn't it?
Beautiful.
Just say yes.
Yeah.
No, but really, so we've been working together. Right now we're actually working from home, and he's been helping me do what I do behind the scenes. He's learned how to be a director, so thank you.
TriCaster
operator. He's been technical directing some of my episodes, and it takes me back to a day when I used to help you in the operating room.
That's right. That's right. Well, that's what I mean. You know, family that works together stays together.
Yeah.
Especially during COVID.
Yeah, especially when they pray together, because it takes a lot of prayer. To be married for 20 years, it takes a little prayer. Yeah.
Whole nother subject.
Anyway, but yes, when we started out our marriage, I was a news anchor, and I used to help you operate, and because we couldn't really afford a staff back then, so we did whatever we had to do to help build the business. Happy to say that Lexington Plastic Surgeons, the flagship brainchild of Dr. Jones's, now has 9 offices around the country that are shut down, unfortunately, right now because of Corona. But soon, and very soon, as I know most of you are hoping who have businesses, we will all be able to get back out and into the world one day.
Yeah, actually looking back, and I think about it, you know, you were a blessing to the practice because you allowed us to turn the basement of our townhouse, our kitchen, into an operating room. But now, turnabout is fair play, right? Because now you're turning the basement of our house here into
a studio. Yeah, so you guys can see the behind the scenes. Yeah, this is my home studio. So when the Corona hit, I jumped into action. I didn't want to be home with nothing to do because that would just be a bad mixture, right? A happy wife is a happy life. So I decided to move my studio into my home, and the only thing is I couldn't bring my staff here. So my dear husband here has learned how to do a lot of different jobs behind the scenes. So
I'm in.
Thank you. So if all else fails, you can always become a technical director.
Listen, my mama always told me to have a fallback, so I've got one now. Thank you.
That's right. It's called a side hustle nowadays.
Okay.
It's a side. This is your side hustle.
All right.
Okay, it's a side hustle. All right, but all jokes aside, I wanted to ask Dr. Jones. I do call him Michael, I swear, at home, but you all know him as Dr. Jones. And for today, we're talking about the coronavirus and the seriousness of this virus and how much havoc it has wreaked on our community, on around the world. And I wanted to bring you on today to talk about some of the fact versus fiction, a lot of the questions that I've been getting from you, all of you on the iWoman Report, just to see if we could set the record straight. We won't be able to answer everything, but I've isolated a few of the questions that keep seemingly coming up over and over again. So we're going to answer some of those questions. But right now, in the news just this week, I just read yesterday in our report, in fact, reported that health experts are warning that 3,000 people a day could die as social distancing rules are relaxed around our country. And so I think it's a good time to really get serious and really talk about some of the things that we need to do to protect ourselves and to protect our families. So let's start with, and I have a few of them in my phone. I'm going to start with number 1. Did you want to say anything first about that?
No, I personally think that those numbers are going to be higher than what they're reporting, and ultimately the death toll will be higher than what they're reporting. But that's just my own little gut feeling, but hopefully it won't be.
Let's pray. Yeah. Well, I was just thinking when I look back at the timeline that we showed on our iWoman Report this week, May 4th, This is just, we're only in May, March 4th, so we're only in May right now, but March 4th, I was on my way to Mexico. We were celebrating our son's 18th birthday, was on my way to a girls' trip trying to decide whether to go or not. We only had 11 deaths in our country then, 11. April, that number went crazy, it skyrocketed. By this month, we are now at almost 70,000 deaths. 70,000 deaths in just 2 months. Yeah, and if this number, as they say, does increase, to 3,000 a day, or as you say, maybe even higher, we're really in for some trouble, and I think that we just need to get educated, and that's what the purpose of today is. Let me start off with this one. I'm going to read this one. True or false? You can protect yourself from COVID-19 by injecting, swallowing, bathing in, or rubbing onto your body bleach, disinfectants, or rubbing alcohols.
False. You don't want to ingest any of these toxic substances. It's written very clearly, very explicitly on the labels. These substances are not for ingestion. Yes, our president did at a time say that perhaps ingesting these materials or using ultraviolet light might actually be something that we should test. But no, it is not anything that we should test, Mr. President. These products are toxic, caustic, and will cause you to die.
Right, so wow, that was really a moment, when I have to say that I don't lie about, my preference and who I think should and should not be, running our country right now. But that was a scary moment for me. The fact that actually sales skyrocketed of disinfectants and rubbing alcohol and things of that sort, as did it for the drug that he touted, that he said, could potentially help you, and so many people unfortunately died from using that drug. So
right, and that again, misinformation when it comes from your leadership is tragic and is a travesty. He is our leader, and just by him saying that, yes, people went out and bought those products. People then started ingesting those products, and there was an increase in the telephone calls to poison controls around the country. You have to be careful in every aspect of what you are saying and disseminating to the public when you're in that role.
Another question, true or false? Getting the corona antibody test will let you know if you've already been exposed to the coronavirus and whether you are immune to a second infection. Is that true or false?
True and unknown.
Okay.
So yes, if you get the antibody test and it shows that you're positive, you have been exposed to the COVID-19 virus. More than likely, you have had an infection. Maybe you were asymptomatic, maybe you were symptomatic, and now your body has mounted an immune response and has created antibodies to hopefully protect you from another infection. Now that's where we don't really have the information. This is a novel virus, meaning it's new to us, it's new to our science. And so, although in most cases when you have a viral infection and your body mounts an immune response and quells that infection, you have immunity for quite some time, and it's very, very unlikely that you would get that virus again. This is just my own thoughts because we really don't have the science yet. It's highly unlikely that you would get that second infection. But getting that antibody test will at least let you know that you have been exposed, you have mounted an immune response, and you do have some antibodies that should give you some type of immunity to the virus.
Okay, and I have to admit, so we both were convinced that we already have been exposed to the coronavirus. So we've been a little cocky confident about it. Like, oh, I can go out, I've been exposed. Our children think that they've been exposed because we were all a little sick in February. In fact, our son he's 18 now, but he had it the worst. And you did too. Like you and Christian were probably the sickest in our family, but our son thought he had pneumonia, he was having a hard time breathing, so we were fairly convinced that we've already gotten over this and survived, only to find out just last week that I went and had an antibody test, and you had an antibody test, and your results were?
Negative.
So are mine, which means neither one of us, at least if the results are right. Now, we don't know for certain because perhaps the results weren't right, but if the results were right, then neither one of us have been exposed yet, which means
that means that we can still get this virus and that we need to be very much on high alert. Yeah, I was convinced that I had it. As much as I travel, I was on planes every 2, 3, 4 times a week. I was convinced. But I guess what it was also telling me, now that I found out that I'm negative, is that I was taking fairly decent precautions all along, with wearing masks, wearing gloves, wiping down the seats on the airplane. So maybe I was doing some washing hands, maybe I was doing something right, but I was certain that I had it.
Okay, here's a good one. True or false? Many of us have been seeing online all these like homemade remedies, concoctions that claim that they can kill the coronavirus. All kinds of stories, from, living in really high heat to making a mixture on your stove where you mix lemon peel and hot water and ginger. You bring it to a boil and take it in. The thought is that it kills the coronavirus in your throat as it is cultivating in your throat before it gets down into your lungs. I even tried my version of that one. You looked at me in the kitchen like I was crazy. But I wanted to know if I boil all these things together, lemon peel and ginger and a little honey, I think I put some orange peel. I boiled it and I took it all in because, the heat should kill anything that's like, culturing in my throat, right? Well, you thought I was a little crazy. Admit it.
I did.
Does that mean that it's true or not true? False?
It's false.
Or is it unlikely?
It's very unlikely. We don't know. Again, this is a new virus, and why tout something without actually having the science behind it? No one's done a controlled, randomized study on heated lemon water and inhaling whatever it was that you were inhaling in that
Right.
crock pot.
It made sense to me. First of all, it was nice. I liked the smell. The whole house smelled great. But
But at the same time, if it's making you feel good,
Better, right.
if you're feeling better, if you have nasal congestion, no question, steam will help with your nasal passages. It'll help open your nasal passages. It might help that mucus to drain better. If maybe the virus is susceptible to heat, maybe it isn't. We don't know whether inside of a human exposing yourself to higher temperatures is going to make a difference. We don't know that. There's just not a study to show.
Okay. True or false? Wearing a mask and gloves will protect you from getting the coronavirus when you go out.
It is not 100% guaranteed by no stretch, but it will help. And again, let's go back to the mask first. So the masks, wearing a mask, what type of mask are you referring to? If you're talking about the N95 masks, those masks will help you from it being exposed to the virus. If there are respiratory droplets in the world that are flying around, those masks prevent those particles from going in if worn appropriately and they're fit tested correctly. The masks that most people now are wearing, cloth masks, handmade masks, homemade masks, those are really so that you are protecting others from your respiratory droplets.
So if you sneeze, you're not sending it out into the universe.
Cough, you're speaking, exactly. You're minimizing that distance that your respiratory droplets are spreading into the environment. So you're actually, by wearing that mask, you're protecting others from you.
Okay.
The gloves are protecting you from touching the virus, because we do know that the virus lives on certain surfaces and can live for quite a while. But you then don't want to take your hands inside the glove with the gloves on and now touch your nose or touch your eyes or touch any of your mucous membranes. You have to be cognizant that you're wearing them, remove them appropriately, and there is a way to do so from the inside out, and so that you don't touch the parts that have been touching other things.
All right, here's another one. African Americans have a bigger chance of not only getting the coronavirus, but dying from the coronavirus.
We are definitely showing that we are obtaining the virus disproportionately to other ethnicities, other races, and we are dying more so from the disease because we have predisposing factors that make death more likely. Diabetes, high blood pressure, problems with already respiratory issues, maybe COPD from smoking. These predisposing factors already drop our immune systems. So they make it more likely that, yes, we will be a population as a whole that would succumb more to the virus and ultimately die.
Right. What I've been seeing is really horrible because, I mean, we're dying at an alarming rate. Our people are really dying, and I think that we're not getting the proper information. I remember early on in this, you would see grocery stores where people were standing outside lined up 6 feet apart, and then you would go into some of the more urban neighborhoods where you would see African Americans and Hispanics, piled in together, and I don't know if they just weren't getting the proper information or they were ignoring it or whatever, but it's really important right now, I think, to exercise caution across the board.
Across the board. Everyone, all of us need to exercise caution. We need to be as educated as we possibly can about keeping ourselves safe and about how this virus is transmitted, or at least whatever knowledge we do have, we need to share. And we need to be aware and minimize the amount of false information that's getting out. We hear people that were saying that blacks couldn't get it.
Yeah.
I mean, what kind of ridiculous
Right.
things was that to say and to kind of put out there and to disseminate that information when it was false? And it maybe that's what predisposed so many of us to not take the precautions and to get this virus. So we have to dismiss those ridiculous things.
Yeah, I didn't see Donald Trump calling that fake news, but that was definitely fake news. And the other thing is, that you may have said this, but we as a race are the ones who typically are having to travel further. We're having to get on public transportation to go do the jobs in other areas, and so we're the ones that are actually probably going to be going back to work right now the most. And how important is it, as we all are migrating back into the workplace, migrating back into life as we once knew it, how important is it to make sure that you are exercising, just good hygiene precautions, avoiding, still social distancing across the board? And should you be going to work if the proper PPE is not in place?
Well, all of what you said is really a matter of life and death. At this point, if you don't have when you're riding that bus, if you don't have the mask that's protecting your neighbor from your respiratory droplets, and them wearing their mask, which is protecting their respiratory droplets from you, then you're putting yourself at risk. If you are not washing your hands, if you're not wearing gloves, if you are not doing those standard things, then you're putting your life at risk, period. When it comes to the workplace, and this is something that's challenging for me even right now as we move to reopen some of our offices, we're trying to put into place systems and procedures and policies that make it safe for our staff as well as for our patients. And so some of the things that we are doing, when you get to the office, you will have your temperature taken. You will then have another triage of your symptoms to see if anyone has potentially been exposed. No visitors will be allowed other than the patient. You will have to don a face mask. We are going to inspect the waiting room to make sure that there's ample social distancing within the wait room. If the waiting room is too full, then patients will ultimately have to wait outside in their cars and be called when it's time to come in. We want to limit the amount of contact, if at all possible, with the patients. We're going to have some temporary plexiglass at the reception desk. We're going to have institute electronic check-in so you don't have to touch a common pen. So there's a lot that we're trying to do to keep everyone safe.
Right, and this goes for your staff as well as the patients that are coming in.
Absolutely.
Right, yeah. Protect yourself. Thank you.
We got to.
Thanks. Can we switch gears now? I do want to talk a little bit. We've been getting a ton of questions about plastic surgery, and so many of you that are home watching, a lot of my girls say they've been putting on the pounds. I have to say I'm probably one of the few. I'm not even going to say it because everyone gets mad at me when I say it. But I'm just going to say it. All right, I've lost 4 pounds since we've been on quarantine. All right, hate me. I'm sorry. It's stress, maybe, anxiety. I don't know. I'm dealing with him every day and my kids. But yeah, a lot of people have been eating, and they want to know when they can make an appointment to come see you. They're all like, I'm getting my liposuction, I'm getting this, I'm getting that. And at a time like now, it's really hard to even think of vanity, but the reality is that people do want to, at some point, get back to life as we once knew it. So Yeah.
So-
When's that time coming?
So firstly, let me just tell you, yeah, it's not fair that you can lose weight when all the rest of us are gaining weight.
Well, have you lost? You haven't lost?
No, I've probably gained about 5 pounds, maybe 6, maybe 7, maybe something like that. I'm starting to lose it now as I'm getting more excited about
Going back to
going
work,
back out.
okay,
But
yeah.
yeah, I think we all have gotten a little pleasantly plump. You know, eating a little bit, not moving as much, maybe doing a little bit too much drinking here and there. So yeah. Anyway,
Yeah.
that being said, it is still the spring. The summer is around the corner, and so much of what we do is not only in doing cosmetics, but in also in treating those patients that have been injured or reconstructive surgery or have keloids. But listen, we treat the mind. We treat the mindset. And if there's something that's bothering you, if you've been at home and you've been exercising and you've been getting ready for summer, but those pounds are not coming off, whatever it is that might be bothering you is not changing, maybe it's getting worse, no better time than now. The way that I've looked at how we're going back into society, it's a reinvention for me. It's a reinvention for my business. It's a reinvention for life. And so this is now a new opportunity for us to reinvent ourselves, to re-engage ourselves in a different way than we had before. And so if you are looking to make a change, if you're looking to make a difference, no better time than the present. We have a backlog of surgery right now that we're working.
Right.
People
People are still
walking
booking. I'm
into.
surprised that. Like, I would have thought that people would just right now say, life is just about so much more than how I look. But no, people are like really booking up. I don't even know if you have any spots available.
We probably don't have any spots available for about 2 months.
Wow.
So all those 2 months that we've not been operating, they're all kind of piled up and waiting. So we're going to go back to a very busy start. But it is a good time.
Okay. So what should people be doing right now? So if you know that you have been putting on a little pounds, let's get fit right now. Let's talk about medically, medical and what you need to do to stay healthy. It's not just about having your body, but it's really about healthy eating, healthy lifestyle. What kind of tips do you have?
Well, and let me tell you, if I lived what I preach, I probably wouldn't have gained those 5 pounds. But listen, it's important ultimately to burn more calories or burn as many calories as you're putting into your mouth every day. So what does that mean? That means doing exercises. That means standing up at your desk instead of sitting. It might mean that you're walking around the house. It could mean that you're doing a 30-minute exercise routine, a 60-minute yoga, 30-minute yoga, any kind of activity that's going to cause you to burn calories. You want the calories that you are burning to equal the calories that you are ingesting. So, and that will keep your weight stable. If you want to lose weight, then you have to burn more than what you're taking in.
Okay. What is your regimen? I know you do yoga every morning, which I'm really impressed by. I don't love yoga. I wish I did. But you do yoga every morning. You exercise.
I do yoga every morning, some kind of stretch. I need to stretch. And I might get on my Peloton and challenge the folks out there for a minute. But yeah, I'd like to do something to get the cardiovascular movement.
And what's your diet? You're gluten-free, but what do you have any diet tricks or things that you...
Personally, I am gluten-free, or make it every attempt to be as much as possible. Also dairy-free as much as possible. I will splurge every now and again on some ice cream. And I think that, everyone may have their own thing or their own vice, that one thing that they really just can't live without.
Yeah.
And that's okay. Because
It's ice cream for me.
Yeah, as long as you do it in moderation, that's really the most important thing, moderation.
Right. So my diet, I joke with everyone, my recommended diet it's called the walk-away diet. So my girlfriend's, told me it's ridiculous, but really, I really do believe it. I believe if you put enough food on your plate and take a few bites of it, just take enough that you feel satisfied, not like overly satisfied, but just satisfied. And then you know what you do? You get up and you walk away. That's my diet.
It is her diet, and it obviously it works. And,
It works
and
for
so
me.
I've actually started, and she told me that I should start following her diet, right? And So I did. So I started putting little pieces of food on my plate, and the plate has a lot of space on it. Take a few bites. I will get up. I'll walk away for a minute, and I'll come back. And you know what? I actually don't want as much. But then she snacks throughout the day, and she said, "Well, you got to follow my diet." So she's bringing me cookies and ice cream, and I'm like, how can you lose this weight eating these things?
Because it's a little bit at a time. So I might eat a cookie. I don't eat like a pack. I might eat, some cashews. I don't eat the whole box of cashews. I eat ice cream, but it might be 2 spoons of it for me. I don't eat like a whole, you don't see me eat a great big sundae unless it's Dairy Queen. I love Blizzards. That's a hard one to walk away from. But it's all moderation. And I really don't drink, so I think that probably helps too.
True.
Yeah. And I do a little exercise, not a lot, but it's enough just to keep me, and my metabolism is okay, I think, for now. But I'm getting old, so yeah, I might be making them. Just save me an appointment, will you? Because I still want to get something done with these eyes.
Anytime.
All right. All seriousness, we're getting ready to all go back to work. I wish everyone well. I want to thank you so much for being here, for joining us, and dropping all these dimes on us, because information is key, especially now. And as you said earlier, it's not just a matter of do I want to or not, it's a matter of life and death. So please get educated, stay informed, watch the iWoman report. We're always going to bring you the latest information. I'm not going to be bringing you a bunch of filler. What we will share with you will be the facts. All right, so thank you, Dr. Jones.
Thank you.
Thank you very much. Will you join us again?
Absolutely, anytime.
You think we can maybe do this once a week?
Yeah.
We can open it up for questions?
Sure, that would be fantastic.
Awesome.
You
All
guys
right.
have questions? Let's do it.
Yeah. All right, so if you want to visit Lexington Plastic Surgeons, you can hit us online, LP Surgeons, or LexingtonPlasticSurgeons.com. You can find all the information on the website, again, LexingtonPlasticSurgeons.com, and thank you. Yeah, that's it.